Hi, this is Dr. Angelchik, and this is the first edition of our new video blog that we're going to be doing from time to time on our website. Today is March 11th, 2009, and I thought I'd just go over some of the common questions that we get here in the office in a blog form. So today I want to talk about some of the differences between saline and silicone gel breast implants, and how you can sort of use that information to choose what might be most appropriate for your situation when you're thinking about a breast augmentation. This is a silicone gel breast implant. This is a saline breast implant. As you can see, the shapes are a little bit different, and there are a variety of shapes that are available in both saline and silicone gel options. Silicone in general, from a cosmetic standpoint, has the advantage that it feels more like breast tissue. It's a more viscous, thicker, gel-like substance, just like the name implies. And so in terms of feeling more like natural tissue, silicone has an advantage. It also has the advantage that in women who are thin, who may not have a lot of body fat or breast tissue, you're less likely to see wrinkles and ripples with this implant as opposed to the saline implant. And where you tend to notice that is out on the side of the breast, where the breast tapers off into the chest wall. So those are the two main cosmetic advantages of silicone. In terms of other issues to consider, as many patients may be aware, there was some controversy about silicone gel implant safety in the United States. For about 15 years, the implants were not available for breast augmentation. So when they came back on the market in the fall of 2006, the FDA attached a recommendation that if you get a silicone implant, you need to consider getting an MRI scan 3 years after surgery and every 2 years thereafter to monitor for hidden leaks. So with silicone, if you have a leak, you may not be aware of it. Now, this recommendation is somewhat controversial amongst plastic surgeons, and most of us have some different ideas about monitoring implant status. In general, that problem is fairly rare these days because silicone gel is more cohesive than it used to be. This is an implant with a leak in it. This is the gel material, and as you can see, it's not leaving in separate little droplets or running like an egg yolk. And so it tends to stay together so that when you have a leak or a defect in the shell, the material doesn't tend to get outside the capsule around the implant into the breast tissue. But on rare occasions that could happen, and that's the reason that the FDA made that recommendation. Now with saline, you don't need to worry about that, because if saline leaks, in essence the body just absorbs the salt water, it's harmless, and essentially you have a flat tire. And you can see a change in size and shape pretty quickly and know that you need to see your surgeon about getting a replacement. If you do have a leaky saline implant, you want to change that out within a few weeks so the pocket doesn't shrink, and that way it's easy for your doctor just to remove the old implant, put in a new one without doing a lot of dissection. Leakage rate on saline implants, probably closest number is about 1% per year. So every year there's a 1 in 100 chance of that implant leaking. With silicone, probably a little bit less for the first 13 years, which is the longest term data we have on this generation of implants, probably more in the neighborhood of 0.8 to 0.9%, or 1 in 110 or 1 in 120 per year. Another factor to consider is cost. This implant, a pair of silicone implants, is going to run about $1,000 more per pair than your saline implants. And when we make our incision to put our implant in, we have to use a longer incision for silicone because this implant is sealed at the factory. There's no valve that we can insert the material, so we can't push this through a small opening. That could damage the shell. So with a saline implant, you're looking typically at an incision 3.5 to 4 centimeters, or 1.25 inches to 1.5 inches. With silicone, it will vary, but probably is going to be around 2.5 inches on average. So that's another factor to consider. Both implants, and I use Mentor implants almost exclusively, have a lifetime warranty, so they will give you a new implant if there's a leak. And for the first 10 years after surgery, you will get some financial help for implant replacement. With the saline, the standard warranty is $1,200, which can be doubled to $2,400 if you pay the manufacturer $100 within 45 days of surgery, and for the silicone, the standard is $2,400. That won't cover every penny, but it will cover most of your costs if you need to change out your implants. So that's a discussion of some of the differences between saline and silicone gel implants. Factors we look at when you come into the office will include your skin quality, how much breast tissue you have, what your aesthetic goals are, the kind of the style that you're after, and what your preferences are. Patient satisfaction rates with both types of implants are well over 90%, so you do have an option here when you're thinking about implants. Thank you.